All right, welcome back, everyone. I hope everyone was able to stretch their legs and grab something to eat or a little bit more coffee. But I am so excited to welcome the new panel where we'll be talking about engaging employers in hypertension prevention and control. I am going to pass over to Rachel Ferencik, who is a program officer at the CDC Foundation. I'm sorry, director at the CDC Foundation. Rachel, it's all yours.
Thank you so much, Jenny. And as I was listening to that fun music, I thought we probably should have had a little dance party in our 10 minutes. So we'll think about that for next summit. I'm so excited to have to be here today and talk with some great folks about how public health can engage with employers as partners in health and wellness. Regional business groups on health are a powerful and often untapped mechanism for accelerating evidence-based chronic disease prevention and management for their employees. As a strategic convener, regional business coalitions on health represent employer interests in working with health plans, health providers, benefit consultants, suppliers, and other system stakeholders to address population health priorities and ensure that when healthcare is needed, it is accessible, affordable, high quality, and safe. Today, I am joined by two superstars that are working in the space of regional health business coalitions. Neil Goldfarb, who is the president and CEO of the Greater Philadelphia Business Coalition on Health, and Lauren Remspecher, who is senior director of member engagement and communications at St. Louis Area Business Health Coalition. We are also thrilled to have Brenda Dooley-Artis with the Special School District of St. Louis County here to provide real-world, on-the-ground experience of what it looks like when an employer invests in the health of their workforce. Welcome, Lauren, Brenda, and Neil. So looking forward to having this conversation today.
Rachel?
Great. Do we have Brenda as well? I'm not seeing her, but I want to make sure everybody can see. There she is. Hi, Brenda. Welcome. I am going to start with a few questions, and I'm also going to encourage participants to put their questions in the chat box, and I will look at those as we are having this discussion and pull from those as we go along. So let's get started. Neil, yesterday when we had our first day of our summit, which was fantastic, there was a little bit of chat going on about the importance of making a strong business case for employer investment in hypertension. Can you tell us a little bit about what the Greater Philadelphia Business Coalition is doing in this space? I'm aware that you're working on making this business case on diabetes, and there may be some lessons learned for us on hypertension. Neil?
Sure. Hi, good afternoon, everybody. So let me just start by saying the Greater Philadelphia Business Coalition on Health is one of around 45 regional business coalitions on health around the country. Lauren at St. Louis is one of our sister coalitions. And so there's great work going on all around the country. And wherever you are, if you don't know if there is a business coalition, you can go to the National Alliance of Healthcare Purchaser Coalitions website, just nationalalliancehealth.org, and look at the list of all the different business coalitions out there. So we're celebrating our 10th anniversary this year. We have 50 employer member organizations representing around 1.5 million covered lives, around half of those lives in our region of southeastern Pennsylvania, southern New Jersey, and the state of Delaware. The employers who join business coalitions, I think, are employers who sort of get it, that they need to do more and that they need to focus not only on the health of their workforce, but also on the value of their benefit spend. So when Lauren and I talk to you today, and when you hear from Brenda, these are employers who are really, I think, at the cutting edge and may not be the typical U.S. employer. Nonetheless, I think there are a lot of lessons we learned from working with these employers. So in answer to Rachel's question, our employers, by and large, get it that they need to invest in health and well-being. And even the decision to join a regional business coalition is an investment in improving public health and the health of their own workforce. So our mission as a coalition is really to help employers figure out the best ways to keep people healthy or get people healthy, and also how to get the best value from the dollars that they're spending on health benefits. As Rachel mentioned, we've worked a lot over the years on obesity and diabetes. So when we ask employers, what are your top 5 concerns or areas of spend, almost always we hear obesity, diabetes, oncology, cardiovascular disease, musculoskeletal disease, and increasingly mental health has been creeping up into that list. But you'll notice cardiovascular disease is there, and that means different things to different people. Nobody's ever said to me hypertension. So one thing is just about, as we move forward, how do we label stuff? And to get employer interest, we really need to look at cardiovascular health, preventing worsening of health and preventing cardiovascular and cerebrovascular events. So what we've done with obesity is we've developed what we call a comprehensive benefit design for obesity. And I think there are a lot of parallels to what might be done in the hypertension space. So I think the first thing we need to do is educate employers on what's the extent of the problem, why is it important for you to intervene, and then what can you actually do about it? So it all really starts with, what's the prevalence? What's the impact on health of your workforce? And then what's the economic impact in terms of both direct medical spend and indirect cost, lost productivity? Now, I'll say that all employers would say to you that indirect cost matters. But the reality is most employers also say, I'm not being held accountable for indirect cost. I'm being held accountable for direct cost. And it's a little bit frustrating. We recently started working on an employer educational piece, what we call an action brief, on hypertension and stroke prevention, and looked at the literature. There's not a lot of literature specific to employed populations. Employers are not always interested in lifetime costs. They're interested in what's it going to cost me. I'm not worried about Medicare. I'm worried about my budget. Now, no disrespect to Brenda and all her colleagues in the employer space. It's a very pragmatic kind of decision. I would say they all care about the health of the workforce, absolutely. But pragmatically, they're going to put more of their effort and attention into things that are going to have real economic and health impact while the person is an employee. And so I'm not finding great literature to talk about prevalence and cost in employed populations. And just as one example, we found a study that said the incremental cost of a person with hypertension who was in a hypertension management program, the savings were around $500 per employee. 400 of those were indirect costs, 100 was direct cost. That's not data that's going to excite many employers to act when they're also dealing with oncology and diabetes and all of these other high-cost illnesses. So I think we need to make a better business case. Once we do that, we need to really help employers with a strategy that is relatively simple, practical, that they can implement, turnkey. So just to give you some parallels from our obesity benefit design, we could think about, first of all, how do you as an employer look at your data? You may be getting reports from your health plan that bundle everything into cardiovascular disease. So you need to be looking at hypertension specifically, prevalence of hypertension and costs of hypertension for your workforce. How can you look at your data? Almost all employers in our coalition are offering some sort of lifestyle change program. We as a coalition have actively pushed the diabetes prevention program from the CDC. And I think many of you know that that's a lifestyle change program that focuses on both healthy eating and physical activity. I don't think it has a lot of content specific to sodium or hypertension specificity, but it would be easy to add that kind of education into something like the DPP and modify it to also address hypertension. So employers are all offering lifestyle change. Many of them already are promoting visits with registered dietitians, which tend to be covered by health plans. So how do we get beyond lifestyle? Well, there are things that you can do as an employer from benefit design. So one of the things we've pushed is value-based insurance design for hypertensive medications, zero copay for any hypertensive medication. The literature on the sort of cost effectiveness or return on investment of VBID for hypertension drugs is pretty limited. So we need better evidence that that is a cost-saving strategy and health improving strategy. Another big piece of the overall benefit design would be heavily promoting primary care. And this is something we should be doing not just for hypertension, but for really everything. So we know that PCPs are the frontline people for diagnosing high blood pressure, managing high blood pressure. So one of the things employers should be doing is looking at how aggressively are we promoting matching people up with a high quality PCP. Pharmacy benefit coverage. What are we covering? As I said, what's the copay or co-insurance? And then really critical for people with hypertension, employer, are you even looking at adherence? And what are you doing to promote adherence? And then just to round out the comprehensive benefit design, we always have a component of how are you addressing health equity and social determinants. And I know you talked about health equity earlier today. How are you combining mental health counseling or training with the hypertension program? And finally, what are you doing about follow-up support for people who've had cardiovascular or cerebrovascular events? Are you ensuring that they're linked into the system for follow-up care so that we don't have recidivism? So, Rachel, that's a mouthful, but hopefully that helps answer your question and give the audience some ideas.
It sure is. Thanks, Neil. And I already see some chatting going on the side that I know we'll come back to. I do want to pivot for a moment and open the floor up to Lauren and Brenda. Lauren, the St. Louis Area Business Health Coalition is partnering with some unique organizations on the Healthy Hearts at Work initiative. And I wondered if you could tell us a little bit about that initiative.
Absolutely, Rachel, and thank you so much for inviting us to participate on today's panel. Similar to Neil, we are considered a nonprofit member association for about 70 large self-insured organizations across the country that are providing health benefits and coverage to millions of employees and family members in the U.S. When we were approached by the Missouri Department of Health and Senior Services with the opportunity to develop a campaign specific to employers, we really wanted to focus on how we could make this as easy as possible, as affordable as possible, and as engaging as possible. We actually started these efforts in 2012 with the Missouri Heart Disease and Stroke Prevention Program, and looking at how a turnkey campaign could really fill a gap for employers and make it much easier for them to communicate, educate, and raise awareness amongst their employees about high blood pressure. We had an opportunity to actually update this campaign in 2020, which I'll talk a little bit about today, which was great timing because, as we all know, we were in the middle of the COVID-19 pandemic, and the needs of employees were changing. Things needed to be more digital, more virtual in nature, and we wanted to make sure that we were being adaptable to those unique needs. So when we talk about the Healthy Hearts at Work campaign, we have a goal of helping employees to really understand what is blood pressure, what are their numbers, think about really assessing their risk for hypertension, and then also some actionable strategies that they can take to improve their lifestyle to manage hypertension. We focus a lot on communication resources that employers can just plug and play into their current programs. We hear constantly that they have many competing priorities. Their teams don't always have the time or the money to spend developing this content. And to the extent that they can receive that from organizations in the health space and just integrate that into their existing communications or well-being structures, that's very helpful. So I think Neil made a great point about when we're communicating about hypertension, we need to be using real-world language. Hypertension, cardiovascular disease are all very clinical kind of medical terms in nature. So when we thought about themes for this particular campaign, we were looking at language that would really resonate with employees. So be heart smart, under pressure, assessing your risk, your heart risks, tracking your ticker, heart heroes, so really looking at those team members in the community that could help them, and then focusing also on those habits to improve heart health. So very rarely within this campaign were we actually even using hypertension as a word, and if we did, it was just to define it and then move on to some lay language that would be very easily understandable for people. In addition to providing some of these email templates that could be used in employer communications, we also built out some resource web pages that, again, could be accessed virtually, digitally, regardless of where an employer or their work sites were located, that had some educational videos that were produced, some handouts that were very easy to download, and then also connecting them back to those evidence-based prevention and treatment guidelines that are being produced from public health groups that are on this call today. A lot of our focus, again, was on creative marketing, and I think we talk a lot as a business health coalition that we have to really think like marketers in the benefits and the health space, because you can have wonderful benefit coverage, you can have wonderful program design, but if employees aren't engaging with that, if they aren't reading it, it's not going to really have the impact that you're hoping for. So we had stanchion banners developed, we had rugs, mirror clings, fun ways to sort of get the message out as people were within their workplace, along with those digital components. And then we added on some additional campaign features depending on the extent that the employer really wanted to work with their community. So the opportunity to maybe do an on-site blood pressure check at the workplace, to purchase blood pressure cuffs that could then be put into common areas or delivered to employee homes, along with instructions for how to do that appropriately. A healthy selfie contest where people could actually take a photo of themselves getting their blood pressure checked, and submit that for the opportunity to get a raffle prize. And then CPR certification, so again, acknowledging heart attack and stroke risk and sort of the efforts around prevention in that area. As Neil alluded to, benefit design is such a key piece of this conversation as well. So in addition to sort of these educational and awareness components, we also really wanted to hone on in helping employees to understand their benefit coverage. So we developed a cardio benefits tool. It's a very simple 2-page handout, just front and back, that really looks at, what are the medical coverages within that employee's specific benefit design for doctor visits, for the preventive screenings that they need to get. If they want to purchase a blood pressure cuff, is that covered at no cost? Things around behavioral counseling, whether that be for stress reduction, for nutrition, obesity, or weight control. Prescription drug coverage, so again, understanding if they're going to owe a copay or a coinsurance. And then any of the well-being programs and solutions that an employer might offer that can really kind of fill the gaps when it comes to some of those behavioral components. To sort of complement that employee education piece on the benefits, we also produced an employer checklist, which we considered a benefit checkup. So really looking at some of the key pieces in the Surgeon General's call to action to control hypertension, we put together some really basic recommendations for employers to go through and just sort of check off. We are currently doing this, maybe we'd like to consider this in the future, or this isn't really a realistic option for us. So as Neil said, really helping them to understand opportunities to use their claims data, their well-being data to understand their population. Getting recommendations around the U.S. Preventive Services Task Force guidelines and what should be covered perhaps without no cost sharing for employees. altering that benefit design to make sure that the copay, co-insurance structures are really incentivizing employees to get their screenings and then continue to manage those conditions over time. Talk a lot about establishing those partnerships in the community. So again, primary care providers, definitely a key piece of that. The local pharmacists, other community organizations that play a big role in people's health. And then certainly policies and environmental support. So we know that sometimes those are the things that can make that healthy choice the easy choice, and that are really supporting employees in making some of these health decisions a little bit more actionable over time. So now that I've described the campaign, I'll just kind of quickly talk about some of the outcomes that we've had. In just the last 2 years since we've updated this campaign, we had 8 employers in Missouri that deployed the program. It was implemented at 76 work sites across the state, and we engaged over 5,000 employees. So these are people that were actually opening up campaign materials, participating in blood pressure checks or the Healthy Selfie contest, responding to surveys about their enhancements of their knowledge and some of their behaviors. Some of those survey results did indicate that we saw a decrease in the number of days since employees had last gotten their blood pressure checks. So it was encouraging people to actually get out there and get screened. Higher confidence in speaking to their doctor about high blood pressure. So again, sometimes it was just acknowledging, what terminology should I be using? What questions should I be asking if I go to my doctor for help? Improving the use of the pharmacy and primary care system for hypertension. So again, a really promising outcome in sort of acknowledging other community partners. And then employees also showed increased knowledge in understanding the long-term complications of hypertension, so things like stroke and heart attack, looking at different members of their healthcare team that could play a role in helping them, and then also the impact of sodium on high blood pressure. So overall, continue to see very positive effects coming out of this campaign. But I really think to understand kind of that impact, it's probably best to hear from an employer themselves. And so that's why I'm really excited to be joined today by a member of our coalition. We have Brenda Dooley-Artis. She's the Director of Insurance and Risk Management for Special School District of St. Louis County, which is Missouri's largest specialized education provider. And as Neil said, members of coalitions tend to be really cutting edge, and that's very true of Special School District. They were the winner of our 2021 Business Health Culture Award, so they're very much demonstrating themselves as a leader in employee well-being, and they've established a very comprehensive approach to tackling high blood pressure and heart disease with over 5,000 employees in 265 schools. So I'm going to turn it to Brenda so she can speak a little to their experience, and looking forward to hearing her remarks.
Thank you, Lauren. I appreciate that. I want to thank the CDC Foundation and the St. Louis Business Health Coalition for inviting Special School District to participate in the panel today. Lauren went over some of our statistics for our organization, but we are, like Lauren said, the largest special ed educator in the St. Louis area and in the state. We have over 22 districts that we support in St. Louis County. We have 265 public schools that we have students and teachers in, and we service over 23,000 special ed students and 1,400 technical students. So supporting teachers and paraprofessionals, our population is very unique because all our kids are somewhat specialized and have some type of special disability. But we try to promote wellness through our various wellness champions. Through the 22 district locations that we do support, we have over 90 wellness champions. So they're out there promoting and educating and supporting all our wellness efforts that we have. And we try to look at the whole health of our employees and kind of let them know it's okay not to be okay, and to ask for help and support from their peers, from our EAP programs, or from just the doctor's offices and that. What we do use for our claims to determine what programs to offer, we use claims from our medical and our prescription plans. And we identify areas that we need to educate or implement programs to improve our overall health for our employees. And hypertension is our number one condition. At 21.7% of our members are diagnosed with hypertension. So what we try to do is address that condition by offering various programs and campaigns throughout the year that help support employee education, to promote compliance for his medication, taking their medications and that. So we did have rolled off the Healthy Heart at Work campaign at several of our locations. We had it at 10 locations in the past, and for those locations, we have in place a kiosk, a health kiosk, which monitors your blood pressure, your weight, your BMI. But then for the locations that didn't have a kiosk, we actually worked with the Business Health Coalition, and we provided the blood pressure cuffs for them. So our outcomes from that is that we had over 407 employees to complete the pre-evaluation and the post testing for the campaign. So what the campaign does, it gives you evaluation surveys to give to your employees regarding awareness, knowledge, and behavior pre and post campaign. So with that, we think that we help employees become better aware of what the condition is. We allow employees to understand that compliance is important, and that let them know, if you're not compliant in hypertension, if that's the only condition that you have, you do have the potential with non-compliance and having a stroke or a heart attack or whatever the other fatalities may be at that point. One of the other programs that we've partnered with is with Express Scripts. So we have partnered with them with the Livongo Hypertension Remote Monitoring Program. And it actually helps employees stay compliant and monitoring their blood pressure, because we've had an employee who had high blood pressure. They were taking their medication as they're supposed to. And without continuous monitoring, they would have known that that medication was not working. That they were taking medication, think they're compliant and everything, and then still their blood pressure was higher than it should have been. So I think that helps with having the health kiosks in each of our locations, working with Livongo, with Express Scripts, and with the Healthy Heart at Work to keep people and employees aware of where they're at and knowing their numbers. And then if those numbers are not where they should be, to actually communicate with your primary care physician about them. So with the Livongo program through Express Scripts, though, they offer free blood pressure monitoring monitors, personalized coaching, and there's a mobile app that they use to track the readings, and they provide personalized reportings to all the employees that are part of this program. We offer the program at no cost to employees, for employees and covered dependents who have high blood pressure and that are on our medical plan. So we launched the program in January of 2022, and for Livongo, we launched that in January 2022. And our stats as of July 31st, 2022, we have over 1,700 recruitable members, those individuals who could be participating in the hypertension management program. And we've had 495 actually to enroll and register in the program, which is like 29% of that population. And then we had an additional, well, of that 495, we have 387 that actually use the device and are actually using it on a daily basis to monitor their blood pressure. So I think just awareness and monitoring and knowing your numbers helps employees understand the potential for additional risk and try to keep and staying compliant with medications and that. One of the other programs that we have the health kiosks in 4 of our locations. And as I said earlier, the health kiosks measure your blood pressure, they have a weight component and BMI. And we actually had the 4 health kiosks in those 4 locations starting in December of 2020. Put this over here. And we've had over 4,500 individuals to go and do readings on those machines since December 2020 to August 2022. And as of second quarter of 2022, we've had over 1,100 total blood pressure readings, and 40% of those readings are in the high range, which is very 461 people had high ranges. So once they have those numbers, we have little information on by the health kiosks that say know your numbers, and they show what's considered normal, what's considered high, and what's considered low. And we provide those to employees, and we also have the information about BMI, what's considered underweight, normal weight, and overweight and obese. And they are able to track that, take that little card to their provider and let them know this is what I'm tracking at work. Let's address this with the PCP. Our partnerships with Aetna and then MMA and our personal assistance program and Business Health Coalition has helped us be able to offer these different programs and devices to employees to help monitor their condition. But one of the things that we look at as an employer is not only, okay, the hypertension, we look at what that can lead to if people are not compliant, the strokes, the high blood pressure and that, and see what other comorbidities they may have, because an individual may have high blood pressure and not be obese and not have the diabetes, so they may have other health problems that's going on that's actually helping trigger that hypertension as well. So we try to look at our data and make a determination of what programs to offer to our employees to improve their overall health and the wellness programs.
Brenda, you are doing a lot there. It feels like it must be your primary job to run this program because there's a lot happening. I know it's not, but it sure seems like it could be. One quick question I had for you is, did you have to make the case to other decision makers that this was a program that you all should be investing in for your employees? Did the numbers do it themselves? And are you getting any responses? I mean, maybe you're the primary decision maker about how this, whether this goes or no goes, but I'm just curious if there's other decision makers you're having to, report to and justify on it and how that's going.
Yeah, so we do have a wellness committee that works and that we go to the board if we need to, if there's a huge cost related to things. But because we do have a budget through our medical plan, we have a little more leverage that we can actually make the decision on our own, opposed to having to go to a board on that. It's incorporated in our contract, so it's not an additional cost that we are actually having to expend on those. So I work with myself and then the director and the of business and finance, the chief financial officer, and then the human resources chief as well. And I work with Aetna, as I mentioned before, our PASS program, and then the Business Health Coalition. So with those individuals being on the part of our wellness committee, we can pretty much make a decision and move forward with it as long as the cost is not astronomical.
Fantastic. Thank you. I think there's some chatter going on the side, which is fabulous. And I see that Lauren and Neil have responded to some. Please, just reminder to throw in any questions if you have them for our guest today. I wanted to open up really to anyone the question, how do you think that employers can partner with healthcare providers and community partners to help address hypertension? What else could we be doing? Neil, you want to go first? I see you're not on mute, so it might be easier.
Sure. So, it's a great question. I think, first of all, Lauren's coalition and my coalition are two that I think about in terms of coalitions that are more heavily engaged in community health and public health, and have probably been more successful in forging relationships with local public health entities and community health organizations. So even among the 45 coalitions, we're not the only ones, but we're probably a biased sample. That said, I think there is a lot more opportunity for collaboration because I maintain an academic appointment at a large university in Philadelphia, we've frequently drawn upon academic partners to help us think about how to develop a plan, how to reach out to the community, how to evaluate something. So I think forging relationships with public health entities, getting them to the table, CBOs, community-based organizations to the table, and academic partners. And then also, we have pretty good relationships with our local chapters of the American Heart Association, the American Diabetes Association, and the American Cancer Society. So they bring educational resources to the table, and it provides us an opportunity to remind them that employers are a key audience and that they need to be better addressing the needs of employers. Rachel, I'm not sure that's fully answering your question, but
That's great.
I can build on what Neil said. So I think we've already spoken to the fact that we see primary care as really being a cornerstone in managing prevention and conditions amongst employees. We have been focused with our employers on helping employees to really get connected to the healthcare system in a meaningful way, because there's a lot of concerns around fragmented care. So if they're going to an urgent care or an emergency department or other facilities that maybe aren't integrated with their medical record, it can be difficult to ensure that they're really receiving what they need, and then that there's accurate kind of follow-up that's happening as a result of that. Previously, we've worked with the National Committee for Quality Assurance. They actually have a heart and stroke recognition program for providers. So there are some data sources where employers, maybe working with their health plans, could identify physicians that are covered within their network that are performing a little higher when it comes to providing evidence-based care and getting quality outcomes specific to cardiovascular health. So I think that's one area to consider. And then to the point of Neil, sort of, I think in the chat we talked a little bit about vendor solutions, and these are a huge sector of the community that's really trying to help employers fill those gaps in care and really help employees to think about those behavioral changes that they can be making. I think the difficulty that we find is really parsing through this exhaustive list of digital solutions that are out there to really understand which ones are evidence-based, that are following the guidelines, that maybe meet the criteria that is being set by public health and medical organizations. So that's something that we've started tackling, and I know the CDC Foundation is looking at some of these opportunities as well, to really help employers identify what questions they should be asking of their vendors before they make the decision to partner, and how do we hold them accountable in really demonstrating the results that they're having in this space, and those financial outcomes, which we know are just so critically important for employers to continue to justify that business case.
That fantastic, Lauren. I think we're down to our last about 7 minutes, maybe. And I wanted to ask my last question, and before I look quickly to see if there's any other questions going on the side. The Roundtable is a group that is trying to catalyze action. We're trying to be in action and catalyze what others are doing. We are not an organization that is on the ground doing work. So when you think about our function, what do you think this group, the Roundtable, could do that would help employers do more to address hypertension? Is there anything that comes to mind for any of you?
I don't want to repeat myself, but I'll say there's been a lot of chat in the chat box about the business case. And so, I think making that business case that both, and not just economic, we're really talking about employers are interested in health as well. So what's the case for employers to invest in addressing hypertension, both economically and from that health and productivity perspective? The other thought I have is, we've gotten through a 45-minute presentation without once mentioning COVID. So I just want to say, for 2 years, COVID was everything for employers, and they had very little time to deal with anything else. So when you hear about people like Brenda, who are actually juggling multiple balls, it's great, but it takes a lot. And I'm sure it was a significant effort for Brenda to get through the pandemic, or as where we are now in the pandemic. So, just think about the business case. I believe I've seen several studies that suggest that the risk of bad outcomes from COVID, hospitalization and death, was significantly higher for people with hypertension. So I think we should just remind people of that hypertension heightens the likelihood of a bad outcome for almost every illness. We've done that with obesity, and we need to do that with hypertension as well.
Great point, Neil. Brenda, Lauren, any thoughts?
I just would like to agree with what Neil said, because the comorbidities is the part that people need to look at as far as long-term effects of hypertension and non-compliance. Like our other top 5 cases are obesity, another one's diabetes, and it can be a comorbidity with the hypertension that these are all falling high on our records of top 10 conditions. So I think agreeing with Neil, like I said, and that there are other things that can prompt or trigger hypertension to go into a much higher impact on your wellness bottom line or your medical bottom line.
I agree with Brenda. I was going to bring up this idea of total person health, which is really kind of resonating on a national level, that we can't just think about conditions in this isolated sense. So often people that have hypertension or high blood pressure may also be dealing with weight control. They may also have diabetes. There might be mental health conditions at play. So to just focus on one piece of that, we're kind of doing ourselves a disservice, and I think we really have to take more of a holistic approach, and certainly for employers, that helps to justify the business case when you can show that connection to other diseases and risks that might be prevalent in their population. I'll also say that I think policy is a really big piece of this conversation, just in general when it comes to health. We've seen recent court cases that are now, kind of threatening preventive service coverage under the ACA. We've got ERISA preemption being called into question. And these are things that are really, can make it more difficult for employers to manage their benefit design and really be thoughtful about how they're approaching this on a national level. And so I think to the extent that public health professionals can advocate for a way that not only serves the patient and the population health need, but also considers how this is going to impact businesses and really making that a reality, will really help us to advance this effort forward in a more positive way.
Awesome. Thank you, Lauren. Neil, it looks like you were answering Hattie's question about group purchasing of SMBP or products. Do you want to just mention that?
Sure. Well, I was saying I'm not aware of any of my employer members who are directly purchasing and distributing self-monitoring equipment. I think each employer, particularly most of the employers who join business coalitions, are self-funded. So they can make that decision of, is this a benefit I want to provide through my health plan, through a vendor? I don't think there are too many employers who are delivering direct care. Some of them have worksite clinics or near-site clinics where they may be making that equipment available. But employers tend not to sort of stock and distribute equipment. It's more a coverage decision.
Great. Well, Neil started with this comment about looking up to see if you have a coalition in your state or region. And I hope that is one takeaway that everyone on the call will do, is find out, do you have a coalition in your area that you can find out what they are up to and become involved in. I think you all are doing fabulous work. You are true, I think, accelerators of the work we are behind in public health. And so I think having a partnership, including you all in the roundtable, and the work all of us are doing is hugely important. Brenda, you are doing fabulous work there in St. Louis, and I think there's a lot that employers can continue to learn from what you're doing. So I think we're all going to be looking forward to hearing more about how the Healthy Hearts at Work initiative continues to go and how many it's going to be touching. Yes, we do need more Brendas and
Thank you.
And Neils and Lauren. So
Yes.
we are big supporters. Thank you so much for joining us today. I'm incredibly grateful. I want to mention that Lauren and Neil are also partners with the CDC Foundation on some other projects, and we're truly grateful for that work. So just really glad to have you all in our corner. And I think thanks again to everyone. And Jenny, I think I'm passing it back to you if that's correct.
Yeah, that's great. Thank you to all of our amazing panelists. That was amazing and so insightful. And I want to just make a point that Janet made in the chat box, and I think